plasma phosphorylated tau could be used to make a pre-screening in what patients would be eligible to participate in a clinical trial. And then with that subgroup, you can do further testing in either CSF or with PET imaging. So that will be the first implementation. It could also be during the clinical trial that you can make repeated measures with plasma. So you can make a blood draw more easily than, for instance, take CSF or perform PET imaging. And perhaps phosphorylated tau could reflect target engagement. Then after, so when we've done more studies in terms of clinical validation, but also technical validation, perhaps at some point it can not only be included in memory clinics, but also at the GP level. So when you go to your doctor with memory complaints, it might be a first selection of saying, okay, this might be because of neurodegeneration, and we have more markers that can indicate neurodegeneration, not only phosphorylated tau. Or it could be, for instance, that it has to do with high stress levels or with psychiatric complaints. I think that would be very valuable, but that's more in the future. What we see now with these phosphorylated tau assays is that it's not very exclusive to be able to perform these assays. So with Simoa technology, any lab could buy a kit as soon as the kit is widely available. And then when you have either Simoa technology in your lab, or you could send your samples to another lab that does have that available, a lot of samples could be measured, and we could also prospectively look in a cohort. So I think that is really where phosphorylated tau is going to make a big change.